Good afternoon. Thank you very much. I'm going to talk about patient empowerment and patient-focused care. In my view, patient empowerment is really something about the patient, while patient-focused care is much more focused on how healthcare personnel is going to deal with patients in general. So I've divided my talk in two parts. First, about patient empowerment, looking at information management for patients and self-management of patients. And there I'll include the Happi app, which I founded a couple of years ago. And then I'll turn over to patient-focused care, where I'm going to show you some ideas about multi-factor analysis, how we do research in the future, which then results in coaching of patients. So first, let's talk about patient empowerment. This is a sort of general feeling that everybody has at the first day of the year, where you have all these good ideas you want to do, and you put them on a board or in your head and make a list. But as this is shown here, it's all separate pieces of paper or separate ideas in your head. This is also how patients look at the information they get. So this is how patients generally go through a day or a week. In the morning, they measure their weight on the scale, which gives you a separate data point, and then they log in, for example, to the hospital to look at their file, or they have a smartwatch, which also generates separate data, or they look at the internet for a complaint they have. So it's all it's not clustered, and it's all in separate files or silos, as you would call them. So for patients, that's a lot of information, but so scattered around that it's not comprehensively easy to think about or to act upon. And that's our vision with Happi. That's what we want to accomplish. We want to capture all these different silo data, put them in one app for patients to easily view and act upon. So we create value by adding services, different services, as is shown here in the picture for patients, which makes their life a little bit easier. So for example, incorporate the Fitbit or smartwatch data, incorporate medication data from the pharmacy and let you organize your medication delivery, incorporate hospital data or research data, all in one smartphone app for patients to be used. And we already have different diseases where we are working with. First one is HIV, but also skin diseases, hematological diseases, and in the summer, this summer, fatty liver diseases will be available. And in later this year, also prostate cancer. So different types of patients can use the Happi app to actively manage their disease. This is all about information, putting information in one place for patients to easily view how it works. That's shown here on the right side of the screen. But self-management is much more. It's about patient empowerment, self-management of patients. It's about self-monitoring, which is shown here, but also about decision support. So first step is information, and then the next step would be how to decide to take action based on the information a patient gets. And in the Happi app, we have done that the following way. There are questionnaires, of course, you will all know them. The HOTS, which is anxiety and depression questionnaire, or questionnaires about social support of the SF-12 for general problems, sleeping problems, stigma. They're all in the Happi app. What we did is we transformed them into a chat, so it's more a fun way of filling in these questionnaires. But then the next step is, when you have this information, what would you do about it? For example, if there is anxiety and depression, or if there is problems with stigma, what do you do with it? So then self-decision, self-support thing comes into place. So they have to be actionable. PROMs should be actionable for patients, and that's really important. So after information, then there's the actionable things a patient can do, and then it's really patient empowerment. So for example, in the Happi app, what we are currently doing, we have the anxiety and depression scale. When they reach a certain threshold, we are now currently developing self-help module, or at least the module was developed, but we are making connection with this online module so patients are easily transferred to this module for self-help. Another example is stigma. There's peer group interventions available, which we help patients to connect to. And then there is self-esteem, which I will show you in the next slide, which is a serious game we are developing at the moment. We call it Happi Match. And what we want to do is patients with low self-esteem or with loneliness want to connect to other patients within our community. what it is done is a serious game in which they play 20 questions where they have to choose between two options. For example, are you a person liking a city more, or you want to live in the outer lands, for example? Or do you like warm weather or cold weather? All these kinds of options, you choose between one of the two, and then there's this profile, and it can be matched with different patients in our community. And in this way, you get to know patients or other peoples which are a bit like you, which have the same matches. And in that way, we create more connection between patients who have loneliness problems or low self-esteem. So we try to make all these questionnaires and problems in the app. First, you want to detect them or give information, and the next step would be making them actionable so patients can really act upon. And that's really, in my view, patient empowerment. So then let's look at patient-focused care. This is more from the healthcare perspective, not from the patient, but from the healthcare provider. And that could be either a doctor or a specialized nurse, for example. This is the classic way of how we bring evidence to the clinic. It's a randomized controlled trial. You all know that we take a set of patients, we have a treatment group and a control group, and then there is an outcome. But this is not really patient-centered. This is for the general person or the general population. And normally in daily practice, your particular patient in your outpatient clinic is not the ideal patient who has been included in this randomized trial. That's all general critics. But what I want to do is that, what I want to point out here is that these randomized trials all have a point A, which is a linear sort of leads to point B. And that's what they are researching. So there's a causality between A and B, but that's not how it goes in real life. This is how it goes in real life. I call it from linear to complex. And it's again A and B, but it's A plus B in a time point C, for example. Today it's rainy, but tomorrow it can be sunny. So the time point is important. The situation, well, I'm now giving a digital lecture and not in a big hall with a lot of people in real life. So the situation, and then that leads to a certain causality, E, in a maybe a different person, or that person is interacting with somebody else. So there's a whole chain of events which all connect to each other, and that means a certain outcome. So the placebo-controlled trials are totally not really showing what is happening in real life. But with current digital devices, we can sort of go into this direction much easier, and that's what I want to point out. So, for example, this patient, he is obese, overweight, he smokes, he drinks alcohol, and if I would ask the question, which factor would he need to stop? Of course, you would say all three. And in this case, it's easy because he has three relatively easy to diagnose factors which are unhealthy. But in my case, for example, I like also to drink a glass of wine, but how much is good for me in relation to how much sports I do, for example, or how less sleep I have, or how much work I do, how much stress I have. So all these other factors are also coming into play. It's not the easy ones, alcohol and obesity or smoking, but also if you are stressed out or not, if you sleep well or not, how is your diet or not. So all these factors come into play. And you all need to take them into account to really provide a focused advice for a patient A, which can be totally different for a patient B, because all the factors are much different. And we cannot solve those problems with a placebo-controlled trial. We need other types of research. And what we currently call it's called digital twins. So what you would want to do is create a digital twin of yourself, meaning all your data you gather, you collect, or at least in our case, the Happi app collects of you. So I showed you the picture where we put all the silos, the different silos, into one digital app. In that app, that creates a sort of digital twin of yourself, because it tells you it's a 50-year-old HIV positive male on these kind of ARTs, smoking, activity, diet, etc. So it's our digital twin created, which we can monitor and which we can compare to others. And that's not an innovative or novel idea. I mean, all these other giants already do these kind of things: Facebook, Amazon, you call them, see them here, Netflix, they all create a digital twin of you. If you watch Netflix, they know much more, or Facebook or LinkedIn, they know much more about yourself than you do. Because what they do, they create a digital image of you, digital twin, which they compare to others in their huge collection of twins. And that's how they give you personalized advice. We call it patient-focused, they call it personalized. But the idea behind it is similar. So I think that healthcare providers, patients, and nurses and doctors alike, we must go from the evidence, which we still need, the randomized controlled trials, but we need to go to more experience-based advice, where we take all these multiple factors into account and really start coaching people, the individual patient, focused on the factors which account for that patient, but not for the other patient. The Happi app, which I talked a little bit about, is free for patients, and the portal is free for care providers, and it's currently in English, German, and Dutch. So a lot of patients hopefully can benefit from the Happi app, and these are the QR codes where you can download it or take a look at our website, happyapp.eu. And with this, I want to thank you for your attention, and when there's questions, I'd like to answer them. Thank you very much.